What's the best treatment for ADHD? That's a question that I get asked all the time in my clinic by patients and parents of children who have ADHD. But it's also a question that can be answered with research. And there are multiple studies that actually try to answer this question. So, in today's video, we're going to take a deep dive into those studies and talk about what the data say is the best treatment for ADHD. But first, if you're new here, I'm a psychiatrist, and I make mental health education videos. The ultimate goal of treatment is to improve functioning. Functioning in what way? Well, we know that people with ADHD struggle with executive functioning, which is made up of things like attention, concentration, planning, organization, self-monitoring, emotional regulation, and impulse control. We also know that people with ADHD struggle with hyperactivity, which can manifest as fidgeting, being unable to stay seated when expected, interrupting conversations, and intruding on others. These symptoms cause impairments in social, academic, or occupational functioning. That's why they're considered a disorder. It's not enough to just have these symptoms. They have to cause you distress or problems with your relationships, work, or school. So how do we know if our interventions are helping? How do we know if we're improving functioning? Well, we use rating scales. Rating scales are just questionnaires that are filled out by the person with ADHD or by a parent or teacher. And they ask questions about how many symptoms are present and how severe are those symptoms. In addition, they ask questions about how well you're functioning at home, at school, or at work. One of the most widely used rating scales for ADHD is the Vanderbilt ADHD Diagnostic Rating Scale. It's called the VADRS, and there are different versions of the scale. There's one for adults, one for children, and one for teachers to fill out. This scale has been used in many of the studies that compare different treatments for ADHD, and it looks something like this. You're asked to rate how often you have inattentiveness, hyperactivity, and impulsivity. Inattentiveness examples include making careless mistakes, having difficulty sustaining attention to tasks or during conversations, having difficulty organizing tasks and activities, avoiding tasks requiring sustained mental effort, and losing things necessary for tasks or activities. Hyperactivity examples include fidgeting, leaving seat in situations when remaining seated is expected, and talking excessively. Impulsivity examples include blurting out answers before a question is completed, difficulty waiting turn, and doing things without considering the consequences. You also rate how well you're functioning in your personal, social, academic, and work or occupational areas. In some studies, the researchers also had participants fill out a quality of life scale, because quality of life is another way of measuring how well you're functioning. One of the most widely used quality of life scales is the Child and Adolescent Quality of Life Scale, CAQLS. And again, there are different versions of this scale for children, adolescents, and adults. And it asks questions about physical health, emotional health, social, academic, and family functioning. So now that we have a good idea of how we're going to measure improvement, let's talk about the different treatment options. The three main treatment options for ADHD are psychotherapy, medication, and a combination of both. And there are different types of psychotherapy for ADHD. Behavioral therapy is the most widely used type. It's also the type of therapy that has the strongest research support for treating ADHD. Behavioral therapy teaches skills such as how to organize and plan. It may involve breaking down tasks into smaller steps, teaching how to prioritize, providing positive feedback and incentives, using visual aids and reminders, and reducing distractions. Now, behavioral therapy is considered first-line treatment, but that doesn't mean that medication isn't a good option. In fact, there are many studies that show that medication is very effective for reducing ADHD symptoms, and in some cases, medication may be more effective than behavioral therapy or behavioral therapy plus parent management training. So which option provides the greatest benefit? Psychotherapy, medication, or both? A study published in 2014 tried to answer this question by systematically reviewing and meta-analyzing studies that compared these three treatment options. Meta-analysis is a way to combine the results of multiple studies to give you a better sense of the overall findings. A study was included if it compared psychotherapy, medication, or both for children or adolescents with ADHD. The researchers found 38 studies that met their criteria. The researchers used effect sizes to determine which treatment was best. An effect size is just a way of quantifying the results of a study, so you can compare the results of different studies. It tells you the magnitude or strength of the relationship between two variables. For example, if you want to know how effective is fluoxetine versus how effective is paroxetine for treating depression, you look at the effect sizes of studies comparing the two medications. If the effect size of fluoxetine is bigger, then fluoxetine is considered more effective. What they found was that medication was more effective than psychotherapy alone in reducing ADHD symptoms, but combining medication with psychotherapy was no better than medication alone. However, medication plus behavioral therapy was better than medication alone for improving quality of life. But again, medication was still better than behavioral therapy alone for improving quality of life. Another interesting finding was that parent management training added to medication was better than medication alone for reducing conduct problems. Conduct problems are things like rule violations, aggression, and substance use. Another meta-analysis published in 2018 came to similar conclusions. They found that medication was more effective than psychotherapy for reducing ADHD symptoms and improving quality of life. They also found that the combination of medication and behavioral therapy was more effective than behavioral therapy alone. And once again, medication was more effective than behavioral therapy for improving quality of life. However, other studies have found that psychotherapy can be very effective, especially for adolescents. One study published in 2016 compared medication, cognitive behavioral therapy, and a combination of both over an 18-month period. They found that after 6 months, there were no differences among the three groups. However, after 18 months, the group that received cognitive behavioral therapy had significantly lower ADHD symptom severity and improved quality of life compared to the medication-only group. This study suggests that CBT may be a good option for adolescents with ADHD, particularly those that are able to engage in the therapy over a long period of time. CBT is considered second-line treatment. That means that medication is considered the first thing to try, but if that doesn't work, then you move on to CBT. But what if you don't want to take medication? Maybe you've tried it in the past and it didn't work for you, or you worry about the side effects. What if you want to try psychotherapy first? Is that a good option? Well, there's another meta-analysis that looked at this question. This meta-analysis looked at studies that compared psychotherapy to no treatment at all. They found 17 studies that met their criteria. They found that cognitive behavioral therapy was more effective than no treatment for reducing ADHD symptoms and improving functioning. However, there was no difference between the two groups for academic achievement. Overall, this analysis suggests that CBT may be a good alternative to medication for people that do not want to take medication. The bottom line is that medication is probably the most effective treatment for ADHD symptoms. And if you're taking medication for ADHD, it's important to give it enough time to work. It typically takes 4 to 6 weeks for the medication to reach its full effect. If you're still having symptoms after trying a medication for 4 to 6 weeks, then it may be time to try something else. And if you've tried a couple of different medications without much success, then you should definitely talk to your doctor about adding in psychotherapy or behavioral therapy. There are multiple options for treating ADHD, and what works best will vary from person to person. Some people respond really well to medication, while others prefer to try psychotherapy first. Still, others find that a combination of both works best for them, and there's no right answer. You have to decide what works best for you. I hope this video was helpful. If you want to learn more about ADHD, check out this playlist here. Thanks for watching. See you next time.